So with neurofeedback, we can put electrodes on your head. It's non-invasive, nothing gets put into you, and we can monitor the brainwave activity in different parts of the cortex. So let's say with ADHD, one thing we know is that it often involves the frontal lobes. The frontal lobes of the brain are involved with planning and organization, inhibition, social perception, social responsiveness. And from the middle to the front of the brain, with ADHD, there's often excessive slow wave activity. We can put electrodes on the head and program a computer to recognize when the brain is making less slow wave activity and more medium speed activity. When that occurs, the person will succeed at a video game. So we have a computer screen where there's a game. It might be a game like Pac-Man. It might be racing spaceships. It might be making a pattern more colorful and complex. When the brain is making that pattern, when it's inhibiting slow wave activity, for example, and increasing the medium speed activity, the person will succeed in the game. The Pac-Man will move through the maze. The spaceship will race.
Right.
When the brain gets out of the pattern, the action will stop. The brain then finds a way to create that pattern on its own by use of that feedback. And hopefully, the brain learns to do that on its own. And long-term studies, at least with ADHD, have shown that the effects it's just as effective as stimulant medication, and the effects tend to last. There's been some longitudinal studies that have gone out for about 2 or 3 years.
So this is for children or adults?
Or adults, yeah.
Yeah, with attention problems.
Right.
Okay, so basically what you're saying is that you can train their brain to increase his medium waves,
Right, called beta activity.
Beta activity to fight off or to improve their performance, basically,
Right.
and counteract the tendency of the brain to stay in the slow wave state.
Exactly.
Essentially.
Exactly.
And how does the brain do this automatically?
Well, that's an interesting question. We're training the brain's capability to do that, the capability to shift state and maintain state. So when the non-ADHD brain, when it's presented with a task to do, automatically inhibits slow wave activity and increases beta activity. The ADHD brain does the opposite. So we're training the brain's capacity to inhibit the slow wave activity and increase the beta activity. And somehow the brain is able to do that when it needs to. Instead of fighting the slow wave activity, that's like being in quicksand or being in mud and trying to lift your leg, instead of that being so predominant, the brain is able to maintain more of a steady state. It's like if you do cardiac training, if you do aerobic exercise, you're not always going to be running fast, but when you need to run fast, your body can do that. So your body is ready to shift into that state and maintain that state when it needs to.
So when you have somebody, you test them to do the video game and you see what's going on.
Right.
Then you give them certain exercises, or how do you actually improve performance with this neurofeedback? I mean, I can see you can differentiate two people.
Right.
One has good medium waves and one does not.
Right.
And how do you then take that person and train them to increase their medium waves by what's the mechanism that you do there?
Well, the mechanism is by the neurofeedback that we put an electrode or electrodes on your scalp, and that measures the electrical activity of the cortex. And let's say in your resting brain state, you're making a certain amount of voltage of slow wave activity, a certain amount of voltage of medium speed or beta activity. The computer then recognizes from that resting state when you're making less slow wave activity, you're inhibiting it, and more beta activity, you will succeed at the game. The spaceship will race. The Pac-Man will go through the maze. The design will become more complex. So your brain gets that feedback. In other words, when your brain is making the pattern that's associated with focused attention, the computer is like saying, that's great, good job, that a boy.
Rewarding you.
Rewarding, exactly, it's a reward. The brain then automatically does that. The brain is the behavior. It's just like in operant conditioning, where we're conditioning somebody to talk more, we're conditioning an animal to behave, we give them a reward. This is the behavior we're looking at is the brainwave activity.
So basically, if the computer recognizes that their brainwave activity is not correct, it won't allow them to succeed at the Pac-Man. It won't
Right.
allow them to, even though people can work through it. True?
Right.
So in other words,
Then the person finds a way, the brain finds a way to get those points.
get those points,
Right.
even though they haven't initiated medium wave activity.
Right. Well, there's
Right.
always some.
There's always
some. So we're looking to increase where you start from.
And the computer will hold it back until
Exactly.
until the brain gives more medium waves.
Right. And I can customize the level of difficulty.
Mm-hmm.
And I can have the computer focus more on inhibiting slow wave if I want to. I can have the computer focus more on increasing beta activity. I can have the computer focus equally on both, depending on what I think the main problem is. With anxiety, we train the brain to inhibit very fast activity and increase a certain activity called low beta or alpha, which is associated with relaxation and physical stillness. So we can customize it depending on the person's symptoms, their problems, their areas of difficulty. And often, there's a diagnostic procedure that we can do beforehand, which is called a brain map or a quantitative EEG, where we take a full cortex EEG that gets run through a normative database. It gets digitalized, run through a normative database. We get back a map of the electrical activity of a cortex where we see where there may be abnormal electrical activity in what areas specifically. So if I'm working with somebody with ADHD, I may put the electrode in the center of the head or in the front, knowing what we know about the physiology of ADHD. With the brain map, it can tell us exactly which spot is the most problematic. And it also gives us information on the connectivity between areas of the brain. What areas of the brain are firing together insufficiently? What areas of the brain may be firing too much in lockstep? They're not individuated enough. And that's been useful in not only working with ADHD, but working with kids with learning disabilities and autism spectrum disorder. So the brain is different parts of the brain are communicating better.
Okay. And so take me through with a child with attention deficit, just without the hyperactivity. The whole training course, how do you approach that with the parents? What's the schedule like? How long does it take to get results? How good are the results with that kind of situation?
Well, if I'm doing an evaluation, the first thing I do is, if a parent calls me and says, my child might have ADHD, I want that evaluated, I have the parents in with the child, take a complete history. I try to see if the symptoms match up with ADHD. Sometimes I'll do some testing. There's computerized testing we do, and sometimes we do cognitive testing like an IQ test to differentiate an attention problem from a learning or processing problem, because often the two can look the same. If the parents want to do a brain map or a quantitative EEG, we'll do that. Not everybody wants to do that. And I come up with a diagnosis if I can. And then I sit down with the parents and I discuss the options. And there are several options. I always offer to meet with the parents and meet with the child to teach them techniques or strategies to understand the attention problem, to monitor it, and to cope with it better. And I always say to the parents, there are two biologically based interventions that have research support. One is medication. It's been around a long time, very effective. I recommend you speak to your child's primary care physician about that, the pros and cons of that. The other is neurofeedback training, and I give them information about that. If they want to proceed with the neurofeedback training, I will develop a protocol on the computer based on the symptoms that I see. Now, with ADHD, in attentive type, often the child is very spacey. They daydream a lot, they can't remain on task, they focus for a second and then drift off. So that tells me that there's a lot of slow wave activity, because the brain is offline. The brain is making too much slow wave activity, so the brain is as if one of us were daydreaming. So the brain map with the QEEG will tell me specifically what areas of the brain have most of that problem. If I don't have a brain map, I will do it by clinical judgment, what I've seen work. If there's hyperactivity, that's a lot trickier, because hyperactivity can be caused by a lot of slow wave activity. If you're bored or you're tired, you think, imagine yourself going to a lecture, which you must have done in medical school a lot, and you're tired and you're bored, you haven't got much sleep. What do you do to keep yourself awake? You tap your hands, you tap your foot, you shift in your seat, you look hyperactive. But hyperactivity can also be driven by a lot of fast wave activity, where your brain is overactivated. So for hyperactivity, we try to decrease the fast wave activity and calm the person down, which usually involves right hemisphere training. And then we shift to increasing the attention, increasing the activation of the left hemisphere. So we may start in the center of the brain. With hyperactivity, we may start on the right side to calm down the hyperactivity, calm down the person. And for inattentive type, we'll start usually in the center of the left side to activate the brain more.
Before we take a break, I want to finish this point. How do you, what is the etiology of somebody having too many fast waves? Okay, that's what the kids who have hyperactivity portion of this.
Could be, yeah.
Yeah, I mean, where does that come from? I mean, if you're saying it's a response to being bored and things like that, which is a slow wave kind of thing.
Yeah, well, the hyperactivity can be a response to slow wave activity.
I see.
Hyperactivity can also be a response to fast wave activity. I mean, if you are agitated,
right,
you know, and you can't sit down, that could be because your brain is over-aroused. You're in an over-aroused state. You can't sleep.
But a child who comes into my office and I've tried to do an exam and he's just touching everything, squirming all over the place, where is that coming from?
It's hard to differentiate. A lot of times a brain map will help us do that. There can be kids who are behaviorally over-aroused but neurologically under-aroused. So we make a judgment as to what area of the brain to tackle first. Usually with neurofeedback, we'll work with different areas of the brain at different times. So we don't just start and stay at one area of the brain.
Good. We're going to take a few minutes break here for some public service announcements, but this is fascinating. I can't believe we've gone through half the program already talking about this. This is great. So, Dr. Spindell, we'll be right back with thank you for joining us on Eye on Health.